Maybe the biggest question that will be asked among the many questions as we have time to look back on this in a few months and over the course of history how will this country, the United States of America, as rich and developed and innovative as it is, not be able to rush out tests or have the tests to be ready for this to begin with? And the answer will be somewhere within the federal government. The President of the United States now having to lean on the private sector. These public-private partnerships are good because they move things along. Why weren't those established earlier? Why didn't we have the tests so we can at least know where we are? Again, we don't even know where we are. Most doctors will tell you the number of cases that we put up on the screen every day that we report to you is not remotely reflective of how many cases there actually are in this country or your state or your city. It's exponentially larger. And that's why you see hospitals across this country bracing for a surge in patients. A new study by Harvard paints a potentially grim picture of beds overrun well past their capacity, even in a best-case scenario, with 20% of coronavirus cases spread out over 18 months. This study estimates hospital beds would be about 95% full in some areas. That number includes already occupied beds and if additional ones are not added. If the infection rate proves to be much higher over a shorter time span, the study found hospitals will be inundated with figures as high as 200% over capacity limits. New York Governor Andrew Cuomo has called on President Trump to enlist the Army Corps of Engineers to step in, but so far a spokesperson says they, quote, have not been assigned a mission. The Pentagon announced it will give 5 million respirators and 2,000 ventilators to Health and Human Services for virus response. Vice President Mike Pence has called on construction workers now to donate masks to hospitals as reports surface that staff are being forced to reuse dwindling supplies. Let's bring in the director of the Climate and Health Program at Columbia University's Mailman School of Public Health, Professor Jeffrey Shaman. He lectures on how to forecast the growth and spread of infectious disease outbreaks. He's the co-author of a new study that shows unconfirmed coronavirus cases are mostly behind the rapid spread of the virus. He was recently quoted in the New York Times saying, if we have 3,500 confirmed cases of coronavirus in the U.S., you might be looking at 35,000 in reality. Professor, good morning. Good to have you with us. So talk about that number that you laid out in the New York Times piece. I think that opened a lot of people's eyes in terms of how much exponentially greater this infection rate really is. Where do you see it right now, and where do you see the gap between what's reported and what's real?
I think it's around a factor of 10. I think for every confirmed case we have, you can say that we probably have about 10 times as many unconfirmed cases in the United States. We did our study that we did recently was for China, where we built a mathematical model and combined it with data and movement data, infection data. And we were able to then estimate that only 1 in 7 people in China was actually being documented. And the rest of them are most likely people who get the disease, but they only experience mild symptoms. It's what you and I normally have during the winter when we get a cold. We might take some cold medicine, we might take some ibuprofen, but we go about our day. You go out and use public transportation, you go to work, you go shopping, you go to the movies, you go to restaurants. And in doing that, you're actually spreading these viruses, these common respiratory viruses around the community. Unfortunately, this pandemic virus has the right combination of stealth transmission, where there are a lot of undocumented mild infections who are still contagious and can spread the virus. And that's why it moves so quickly from place to place. And at the same time, it has this age group of people. It's got a fat tail where there are certain people who are having critical complications associated with the infection, and there's a high mortality rate. It's got a really lethal combination that makes it the most difficult and dangerous virus that we've dealt with since 1918.
Professor, you study these things for a living. You study this kind of health and environmental question. Can you help answer why the tests have taken so long to get out? I know there's logistics and bureaucracy there that aren't what you study, but just as someone who knows how this usually might work, why don't we have the tests we need at this point?
Well, I think you guys have been talking about a lot of the points, and I think you can speak better to it than I have, because I haven't been following the governance and the policy that's been put in place as closely as you have. But clearly some needs have been dropped. The CDC needed to get some of this out faster. I work with colleagues in the CDC all the time, and I know they're doing their best. But the idea that we needed to have clear and consistent messaging about how grave and difficult this virus was a month ago, if not 6 or 8 weeks ago, would have been paramount. And we need to have more of these tests distributed. I would say that, honestly, the U.S. is not the only country in this circumstance. It's variable from country to country, but there are other countries that are also not testing at the rate that we need to in order to document this infection, know where it is, and have a better sense of just how many cases there are and how much this wave of growth is going to overwhelm our hospital systems.
As you said, this virus thrives on people mingling and meeting each other. You've said we need to keep people apart. I'll ask you a question we've put to other experts over the last couple of days. Do you believe there should, at this point, be a national quarantine? In other words, everybody just stays home until further notice?
That might actually be very effective, but obviously that's going to have enormous economic, psychological, and emotional consequences because we don't know the end game of this. You know, typically when you resort to social distancing, isolation, and quarantine, school closures, things of that nature, you're trying to buy time. You're often trying to buy time so that you can develop a vaccine. As Anthony Fauci, the director of NIAID, has said, this is going to take some time to develop a coronavirus vaccine. We're not as adept at it as we are for influenza. Back in 2009, it was about a little over 5 months from the identification of the virus to the rollout of a clinically tested FDA-approved vaccine that was effective. For this coronavirus, we don't have that template. It's a very different virus. We don't know how successful we'll be in our endeavors. So we're looking at something that may be more like a year or a year and a half, as some of the experts are quoting to you. So how long can we maintain this? How do we go about actually restricting contact? Because that is fundamental and key. We have to reduce the number of contacts between people so that we can flatten the curve, as everybody has been saying, and we don't see our hospitals overrun.
And just
I would like to add, I'm sorry, go ahead.
Go ahead.
You know, the problem with hospitals overrun is not merely that it deteriorates patient care for those with the infection. It has all these deleterious effects downstream because you no longer are able to give the patient services that you need to everybody for everyone else. The routine services, childbirth, vaccines, dialysis, chemotherapy, emergency services for accidents, all those get scrapped in some essence. They're not as available, and the quality of care erodes for everyone. So it's incredibly important that we don't see our hospital systems overwhelmed the way they have been in Italy and China earlier as well.
And you're right, that's already happening. Some doctors in those specialties you described are being enlisted now to move into the emergency room. Dr. Jeffrey Shaman of Columbia University School of Environmental Health Sciences, appreciate you being here this morning. Thank you. Mika?
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.